Okay, so today we're going to look at a lot of directional terms and also like regions of the abdomen and then the cavities of your body. So whenever we're looking at directional terms, it's always based on a person standing in anatomical position, which means your body is upright, you're facing forward, your feet are together facing forward, not out to the sides, and the palms are facing forward, not back. So when you're looking at the front, you should be able to see the palms of your hand. Some of the other body positions, supine means you're laying face downward, laying on your stomach, and prone means laying face, supine is face upward, laying on your back. Prone is laying face down on your stomach. But usually when we're dealing with directional terms, we're talking about anatomical position, and there are a couple, so some directional terms. Superior and cephalic mean the same thing. Cephalic means the head. Like if you have hydrocephalus, that means you have water on the brain, or anytime you see that cephalic term in a word, that's usually talking about the brain or head. And so superior cephalic means towards the head, so it'd be upwards. And then inferior or caudal means away from the head or towards the feet. Medial versus lateral is relative to the midline, so if you're getting closer to the midline, you're medial. Lateral will be away from the midline. So I guess the humerus would be lateral to the sternum. So your humerus is right here in your arm, and then your sternum is your breastbone, and so your humerus is lateral to the sternum. Or you could say the sternum is medial to the humerus. Depending on the order that you have the parts, the body parts, then you can have either of those directional terms. Proximal and distal are used to describe linear structures, used to describe structures on an appendage, so in your arms or legs. And it's dealing with whether you're close or far from a point of attachment. So on my arm, I could say my wrist is distal, farther away from the point of attachment than my elbow. Or I could say my elbow is proximal to my wrist. Either way. The reason why we use those terms instead of superior and inferior, what if my hand's up here? Now superior and inferior has changed, so now I can still use proximal and distal. Proximal and distal don't change no matter where your hand is, where your arm is. And then superficial and deep is relative to the surface of the body. Superficial would be closer to the skin. Deep would be farther into the body. So your epidermis is superficial to your muscles. Be one way you can use it. And then when we look at front and back, we use the terms anterior or ventral, means towards the front. Posterior or dorsal means towards the back. If you think of a dorsal fin on a shark, where is the dorsal fin usually? On its back. So dorsal means towards the back. Posterior is towards the back. Okay. So you could say your sternum is anterior to your vertebrae, or your vertebrae is posterior to your sternum. And that's a summary of them all. So what would be, let's say, your ear to your eye? What would you use? What do you think? Which one's medial? So your eye. So your eye would be medial to the ear, or your ear is, what's that other term? Lateral to your eye. So your ear is lateral to your eye, or your eye is medial to your ear. What about your chin to your forehead? Your chin is what to your forehead? Inferior or What's the other term for inferior? Caudal. So your chin is inferior or caudal to your forehead. What about your big toe to your ankle? Yes, your big toe is distal to your ankle. Okay? Or your ankle would be proximal to your big toe. Questions on those directional terms? Pretty sure the lab tomorrow you'll use those. Okay, then there's some different body parts and regions that you need to be familiar with, and this will be on the lab also, or not tomorrow, Monday. A lot of these terms are based on the bones that are underneath of them. Some of them aren't, and I'm not sure where they get the terms, but we'll go through a couple of them. We'll work more with them on the lab. Like frontal, the frontal region is your forehead region. This is the frontal bone of your skull, so that's what's frontal. Whoops. See, the sternal is this breastbone area. The umbilical is the navel area around your belly button. So you can see there's femoral. The bone that goes right here is the femur, so it's the femoral. Patellar, the patella is the kneecap, so the area is the patellar. Calcaneal, the heel, the calcaneus is the heel bone, so it's that's why it's called calcaneal. The plantar is the sole of the feet. Have you ever heard of like plantar warts or plantar fasciitis? That's all on the sole of your feet, so that's where they get that term. Okay, the front of the knee is patellar, but then the back of the knee is popliteal, so they have a different term there. Gluteal for the gluteus maximus and gluteus minimus and gluteus medius. That's all in your buttocks area. Lumbar, it's your lower back usually, around there. Occipital. Occipital bone is at the base of the skull, so it's the occipital area. So you can kind of see some of those terms will fall into place based on what else is located, what structures are located there. Okay, and then if you go to the doctor with a stomach pain, usually they will ask you where it is, and they will label it as either quadrants or subdivisions. Quadrants is just into four, right upper, left upper, right lower, left lower. But look at the image, and the right upper, is that on the right side? When you look at it, it's on the left. It's based on the patient's right and left. Okay, so it's based on that person's right or left. So that's why it's the right upper. When we look at it, it looks like the left, but it's his right. More specific, though, the regions or subdivisions, there's 9 regions that you can split the abdomen into. And the first one here, right hypochondriac. What does hypo mean? Do you know? If you're hypoglycemic, yeah, so it's lower. Hyper would be above, but hypo is lower, right below. And chondro means cartilage, so hypochondriac would be right below the cartilage, and they're talking about the cartilage of the ribs. So it's right under the cartilage of the ribs here. What does the prefix epi mean? You know? It means above. And gastric, what do you think gastric means? The stomach. So it's right above the stomach. And then the left hypochondriac region. Right lumbar region, we already saw the lumbar region on the previous slide, but it's lower back area. So the right lumbar region over here, the umbilical region is right around your belly button. And then the left lumbar region. And then the right iliac region, and on your pelvic bone, the crest on the top is called the iliac crest. So that's where they get the term iliac. So right iliac region would be on the right side of your pelvic area. Hypogastric, hypo we said was below, gastric was stomach, so it's below your stomach. And then left iliac region. So those are the 9 regions that we'll be using. Okay, body planes, different ways you can cut through a body, or even when surgeons are making incisions, they'll base it on planes. So the median plane is right through the midline. So if you cut the body right in half, right and left halves, that would be the median plane. Sometimes that's also called the mid-sagittal plane. You'll see that term a lot also. A sagittal plane is any plane that cuts the body into right and left halves, but they aren't equal halves. So anywhere, as long as it's going into right and left halves. The mid-sagittal, since it has the word mid right in front of it, is right in the middle. It's a sagittal plane that's right in the middle. Frontal or coronal divides the body into anterior and posterior, so it's cutting your body to front and back halves. Frontal or coronal plane, you'll see both terms. A transverse or cross plane divides the body into superior and inferior sections. Anywhere that's cutting your body in half, kind of like a magician would. And then oblique is anything other than a right angle to those. So if you're cutting at an angle through the body, that would be an oblique plane. Okay, they also use terms to describe cuts through an organ. And this is an example of the small intestine, but a longitudinal cut is along the length of an organ. So here's the longitudinal cut. See, it goes along the length of this organ. After you cut it, this is what that cut would look like. The cross or transverse is going at a right angle to the length of the organ, right here, and then oblique again at any angle other than a right angle. Questions on the body planes? Okay, then the trunk cavities. You really have 2 major trunk cavities, the thoracic cavity and the abdominal pelvic cavity. And there is a physical barrier that separates those two, and that is the diaphragm. So the diaphragm divides the body cavity into thoracic and abdominal pelvic cavities. Now those cavities are split into 2 themselves, but there's no physical barrier. So like in the abdominal pelvic cavity, you can see there's the abdominal cavity and then the pelvic cavity, but there's no actual physical barrier. The thoracic cavity can be split into the mediastinum, which contains all the structures of the thoracic cavity except for the lungs. So it includes the heart, the esophagus, the brachial tubes, bronchial tubes, the trachea, all these structures here. The thoracic cavity, the other part of the thoracic cavity, including the lungs, would be called the pleural cavity. Anytime the word pleural is included, that means lungs. So you have the thoracic cavity can be split into the mediastinum or the pleural cavity. Okay. These cavities are lined with serous membranes. And so this is a representation of those membranes, and they have a balloon, and you pretend like you stick your fist into it. So the inner balloon wall represents the visceral serous membrane. So the balloon that is actually touching your fist would be called the visceral serous membrane. The outside balloon wall is called the parietal serous membrane, and you can see that it's actually, I mean, it's one membrane. It's not stopping and starting anywhere, but it just depends on whether or not it's touching the organ. And then the cavity between those 2 membranes for a balloon is filled with air, but for visceral and parietal membranes, it's actually filled with a lubricating serous fluid. And that helps reduce friction so that those 2 membranes aren't rubbing against each other. It reduces the inflammation that would occur if there was that friction. And those serous membranes can be named based on what organ they're covering. So the pericardium refers to the heart. So there's a membrane that goes around the heart. There's a visceral pericardium and there's a parietal pericardium. Remember, the visceral would be where? Where would the visceral pericardium? The inside one, the one that's actually touching the heart wall. And then the parietal is outside, and there's some fluid in between so that when the heart beats, there's not going to be any friction between those membranes. Okay, pleura refers to the lungs and the thoracic cavity, so it's covering the lungs. There's a visceral pleural cavity, or visceral pleural membrane, and there's a parietal pleural membrane. And then peritoneum refers to the abdominal pelvic cavity. It's covering like your stomach, liver, small intestine. I know we won't dissect until probably in May, April or May, the pig. But when we dissect the pig, or if you've ever dissected a pig or anything with intestines, there's actually this membrane that kind of fans out and connects all the small intestines together so that they aren't like falling all over in the abdomen. That's called the mesentery, and it's also part of that peritoneum. There are some organs. Right here, you can see in that picture where the peritoneum is. Shoot. There we go. You can see that blue line is the peritoneum, along with, well, yeah, and the purple line. But there's organs here. There's the kidneys, the bladder, the colon. They're called retroperitoneal because they're behind the peritoneum. If this is the anterior side, the dorsal side, they're behind the peritoneum, and they're called retroperitoneal organs. So they don't actually have that membrane around them. You guys have questions on the membranes or the names of the cavities? The cavities and organs. It's on the, yeah. Oh, it's part of the heading, huh?